right, it's time for Healthline, your number one health show on radio. And today's show is going to be very special because we have a few guests who are here to talk about a topic that is very pertinent. Now, according to the National Cancer Control Plan 2018 to 2022, the statistics are staggering, with 102,000 new cancer cases every year, I beg your pardon, in Nigeria. And I say it's staggering because what it shows is about 280 cases a day. And unfortunately, 72,000 deaths are linked to cancer in Nigeria. My two guests that will be having a conversation with us, one is an oncologist who will be speaking with us from the perspective as being a medical practitioner, and the other speaking with us from the perspective of a survivor. I will be introducing our oncologist. His name is Dr. Aje Eben Aje, who is a consultant clinical and radiation oncologist, as well as we also have in the studio with us Fortune Ebel, who is a cancer survivor, who will be speaking with us, sharing with us his journey, his pain, and of course the hope and life after. Good morning, gentlemen.
Morning, Nigeria. Good morning, Lagos. It's nice to have me here.
Yes, nice to have you here. And Fortune.
Good morning, Lagos Talk. It's a pleasure being here.
It is a pleasure to have you here. It is a pleasure. So let's start with you, Dr. Aje, because I did mention, based on the statistics, it's quite staggering. I really want to know, with your experience as an oncologist so far, I know that a lot of people want to really know, that burning question of what really is the cause of cancer. But even before we get to that, I want you to break it down for us, because I know that you specialize in different areas: head and neck cancer, breast cancer, prostate cancer, and molecular genetics of cancers as well. And we really want to know what in general is cancer, and then we can now break it down to the different types of cancer, especially the ones that are common to us here in Nigeria.
Okay, thank you for having me, Lagos Talks. As introduced, my name is Dr. Aje. I work in the NSIA Youth Cancer Center. So cancer, broadly speaking, is a genetic disease. It's a disease that affects the genome. And as there are many parts of the body, so there are cancers that can affect every single part of the body, except, of course, the hair on your head, your fingernails, and the teeth, right? So those are just three tissues of the body that cancer cannot affect. It can affect every other part of the body, right? Having said that it's a genetic disease, the cause is not known, but there are risk factors that are associated with cancers. And these risk factors can broadly be divided into the modifiable risk factors and the non-modifiable risk factors. The modifiable risk factors are those that have to do directly with a genetic basis. These ones are diseases, for example, that run in certain families. I mean, you have breast cancers that run in certain families, ovarian cancers that run in certain families. So you have a history of a mother or an aunt that has these cancers, and as such can be inherited. The children or other relatives can inherit that particular gene that is responsible for those cancers. And these particular genes, we talk about the BRCA gene that is responsible for most breast cancers, ovarian cancers, and intestinal cancers, for example. And then you now have the modifiable risk factors. These are risk factors that basically is associated with the lifestyle of individuals. Now, smoking, for example, is a lifestyle thing. People smoke as status. People smoke as a form of an elitist lifestyle. There are cancers associated with that. Lung cancer, for example, bladder cancer, for example, associated with that. And there's alcohol consumption, which is also an elitist kind of lifestyle. And you have liver cancer and other cancers associated that. And you have in a situation where people have multiple sexual partners and partners with multiple sexual partners, then you have the genital cancers that are associated. So there are risk factors that point to particular cancers of the body. And so that's the broad way with which we will classify these cancers. So we may not particularly be able to say that this is what caused it, but from the risk stratification of the individual, you could say, okay, this is likely what may have been responsible for that cancer.
All right, thank you so much for breaking that down. Even before we go further, I do want to rectify that Fortune Ebel is actually the brother to a cancer survivor. Sorry about that. So we just need to rectify that. And he will be sharing from his sister's perspective as well. So thank you so much for coming to have this conversation with us. Now, Doctor, I want to know, with the statistics that I have reeled out in Nigeria, is there any cancer that you would say is the most common, or are there a few that are very common amongst us here in Nigeria?
Okay, yeah, there are cancers that are common amongst here in Nigeria, and I mean that could easily be related to our population distribution. There are more females than males averagely, so they would expect that cancers that affect more females, would be more than those that affect the males. Then it could also be attributed to social character, social behavior, the social milieu that we have. So generally and broadly speaking, breast cancer happens to be the most common. All right. You have breast cancer in both males and you have it in females, right? But for female cancers, breast cancer happens to be the most common cancer that affects females, right? And 1 out of 10 cancers would affect the male. So it's not just about the female gender alone. You have breast cancer affecting both males and females. For clarity purposes. Then you have the genital cancers, cervical cancer, endometrial cancer that affects only the females, the female folk. And that could, it's another gamut of disease etymology on its own. Then you have the prostate cancer. Women don't have the prostate organ. So it's an exclusive cancer that affects the male folk. Then you have the colorectal cancer. Now, this is a cancer that is across both genders, right? But it's more in the female than in the male. Then you have other cancers, the aerodigestive cancers, the nasopharyngeal cancers, the laryngeal cancers, the cancers that involve that we call the head and neck cancers, mostly that the population distribution is not as clear-cut as we have in breast or cervical, in breast cancer particularly, where the ratio is almost similar, but we don't have as much, we have very low lung cancer here, because we don't have a culture of smoking, unlike the West. The temperature in the West is very, very low. So this is part of the ways in which they keep themselves warm by smoking. But smoking here in our side of the world is like an elitist kind of tendency, so we don't have a lot of lung CA, even though we do have, but compared with the figures in the West, it's not as high. But it's good to note now with a surge in young people smoking, they smoke shisha, they smoke weed, they smoke all manner of things now. Yeah. So there's a gradual surge, and there will be in the next 10, 15 years of cancers that's going to be involving the head and neck, right? So there are cancers that affect every other part of the body, but it's just that emphasis and public health interest, the light is beamed on some cancers more than the other cancers. But just as I told you earlier in my opening statement, the hair, the finger, and the teeth are the only organs that are not affected by cancer. Every other organ of the body is can be affected by cancer. Thank you.
Oh, thank you very much for that. You know, you had mentioned in your opening statement talking about lifestyle, certain lifestyle habits of which you related to, you know, smoking in Nigeria, it being an elitist, you know, type behavior, and in the West, it being maybe closely related to their climate. I really want to know in terms of the food consumption as well. You know, now, you know, there's this general maybe joke that goes around where people say everything causes cancer. You know, the deodorant that you're using is causing cancer. You know, the processed foods that you're eating is causing cancer. I really want to know if there is any truth to that, especially regarding, you know, what we're consuming and what we are applying on our bodies as well.
Okay, so back in the day, maybe the days of my parents and my grandparents, a lot of their foods are not processed. A lot of foods have high fiber. You know, they take high fiber foods, non-processed foods, and the foods are well cooked before they are taken. Now, globalization and westernization has brought this aspect of Western life on us, where our foods are highly processed, sugars are highly refined, and I mean, there are quick fixes that we can pick up. Now, for gut cancers, when I talk about gut cancers, I'm talking about colorectal cancers, are cancers that are associated with the etymology of those cancers are associated with low fiber diets. As against our parents that have high fiber diets. Now, they are low fiber diets, and these diets have little bulk effect in feces, right? Little bulk effect in feces will also mean that there's a low transmission speed within the gut itself. You know, so feces stay longer in the gut because they are low fiber, right? So when you have these fast foods, the implication of these fast foods is the fact that there may be a likelihood, right, in the occurrence of colorectal cancers that occupy that space. Now, I should also mention that lifestyle, you know, anoreceptive sex, you know, could also be a risk factor in anal CA. Anal CA is one of the 8 defining cancers, you know, that particularly found in people who have anoreceptive sex, particularly those who are the receptive ones, you know, and have that kind of lifestyle. So let's go back to the ways in which our parents lived. Let's go back to the vegetables. Let's go back to the fruits. Let's go back to the high fiber diet, you know, because those are the kind of foods that help, you know, and will reduce the incidence of gut cancers, the colorectal cancers. And I must also say that having considered that, there is also the genetic end of it, you know, where you have these diseases that run in families. But that is just a small percentage. So it's got a lot to do with a kind of lifestyle that we take now and the kind of stuff that we take in.
Wow, that's very loaded. Thank you very much for that. And I really do wonder how it's being diagnosed, you know, with the various types of cancers that you've ruled out to us. Are there common symptoms that cut across, or are there unique symptoms per the type of cancer? And how is it diagnosed in general?
All right. So the body is a wonderful machine that God's put together. I compare the body with your car. Your car has a particular engine. When you turn it on in the morning, there's a particular sound it greets you with when you turn it on. The same thing with your body. Your body is it's a machine that God's put together, and your body has normal functions. Now, when there is a deviation from that normal function, it's a red flag for you to get to know that there's something wrong happening in a particular space that you need to pay attention to. So let's look at the woman folk, the genital urinary cancers now. We're talking about the cervical cancer, endometrial cancers, and vulvar cancer. A woman has a regular monthly cycle, right, that starts when she begins to have her monthly period. Now, that is expected because it's part of her normal physiology to have that. But when a woman begins to bleed outside her normal circle, right, it is a red flag. You should go see your obstetrics and gynecology doctor. You should see your GP and you complain that, okay, look, I'm having this bleeding outside my regular monthly circle. Now, that cannot be taken in isolation. There's also a discharge, a watery discharge that comes out, initially non-offensive, but gradually now gets offensive, malodorous, and people say that that person smells, that kind of thing. I mean, we had stories of the fact that there's a kind of malodorous odor that comes from a particular person. Now, these are signs to tell you that there is something wrong. So when you have abnormal vaginal bleeding, abnormal vaginal discharges, now these are red flags for you to go see your doctor. Now, other symptoms that have to do with the gastrointestinal systems are when you begin to see blood in stool, blood, you have bloody stool, or you're having recurrent diarrhea alternating with constipation, which is not your normal body pattern. Then you should see your physician. Then for the cancers of the head and neck, you're coughing out blood, you're vomiting blood. These are not normal things, normal symptoms that you should see. Or ordinarily, you just suddenly feeling tired. You're feeling tired for no just reason, right? Then you should see your doctor. This is what I advocate. Every birthday celebration of yours, aside from hosting a party for family and friends, please go do a checkup. Do a checkup. That is your gift to yourself for your birthday celebration. All the Ashwebi, the 70,000 naira Ashwebi, 150K Ashwebi, and all of those things that we commit to family and friends in celebration. How well do you celebrate your own birthdays? It's not enough for you to take yourself out. Part of the places you should also visit is the hospital. Go run a full check. Go check your numbers. Go do some imaging checks. Let the doctor check you out and make sure that you're fine. That is your birthday gift to yourself. So the body will always give signals to tell you that there is something happening in a particular quarters. These symptoms are not taken in isolation. Now look at the risk factors. Someone who has a lady who has a man friend, right, who has started having sex at the age of 8, 9, 10, right, who has multiple sexual partners, and the partners also have multiple sexual partners. Now, this lady is at risk. So aside from the symptomatology, we also look at the risk profile of this particular young girl, right? And let me say, the media is culpable for this. There's all manner of obscene videos, obscene songs that the media, visual and audio media pushes out to young people these days, and they make them, it makes this kind of lifestyle look appealing and make them look good. Now, what they don't tell us behind those lifestyle is the fact that there are dangers associated with them. So girls are introduced to early sexual activity on time. They have children out of wedlock, and they drop out of school. All these are cumulative problems that are risk associated with cervical cancer and endometrial cancers. Now look at smoking, for example. This young boy, because of association with peers and relationship with other young children, he started smoking at a very young age. Now that is going to upset the normal lining of the airways. He does that culture now for the next 10, 15 years. He probably might just be in his 35 before he gets to his middle-aged life. Something's going to be wrong, right? Because of a risk that he's exposed himself unduly to. So there are the symptoms that the body gives, and there are the risk that is associated that your doctor will have to elicit for you, that this is part of the risk. Now, how is it diagnosed? You go and see your doctor, they run some tests for you, they run some imaging also for you, and they will see that these things, there's something amiss, there's something wrong, there's something not in place here. Then intervention can be started early. People have a notion that cancer is not curable. is because we present late. When presentation is early enough, then it can be cured. In the West, there are people with 4 or 5 cancers, survival 4 or 5 cancers, because health for them is top notch. They have regular medical checks. So immediately it's spotted, it's picked up, and it's nipped up in the bud. Let me just talk about breast cancer before I yield the mic. Now, a woman comes with a lump. She presents with a lump in the breast and just tell you that there's nothing about it. I mean, there's nothing, just keep on observing it. But it could be a non-cancerous lump, and it could be a malignant lump, right? For the non-cancerous lump, it may either disappear or just linger there for as long as the woman bothers, right? But for one that is a cancerous lump, the changes now begin to come. By the time she gets to discover that there is a difference in the size of either breast, then it's late as it is, right? So there's little the doctor can do, the little the oncologist can do, than having to just manage you palliatively. But if we have a culture of presenting to the hospital early enough, have a culture of doing regular medical checks, then this thing can be picked up as early as possible while the growth is still very, very small, right? And it can be nipped up in the bud. We have women who are 15 years survival, 10 years survival of breast cancer that comes to see us in the clinic. The difference is the attitude of early suspicion, early diagnosis, early treatment, then we follow them up for life.
Wow, that's very, very enlightening. And just still on the female anatomy, I want you to, enlighten us about the role of the HPV shot. We always hear that, and people are not yet enlightened enough to understand what really is it. Is it necessary? Is there a particular time or age as a woman you need to take it? If you don't have the shot, does it mean that you will eventually get cancer in the future? What is the correlation?
All right. So it's a whole lot, right, put together. The HPV shot, right? There is the Cervarix and the Gardasil immunizations, the immunizations against the cervical cancer, the human papillomavirus, which is the culprit for this cancer that is sexually transmitted, right? Immunization starts as early as 8, 9 years old till 13, before a sexual debut of that child. It's important. Before that child makes a sexual debut, you need to have that child have the vaccine, right? So you ask me, what happens when someone who's had multiple sexual exposures to have the vaccine? It's not been scientifically proven that the vaccine will protect that person after he or she being exposed, right? It's not been proven. So there's the best time to have it is before sexual exposure. Now you now ask me, so what happens now? I've had some, I've sown my wild oats, I've had some fall, now I'm hearing about it. Then you need to change your lifestyle. We are also an advocate for lifestyle modification. You need to modify the kind of lifestyle you have. If you're on a fast lane that could get you into trouble, then you need to get out of that fast lane and try to shed off the excess weight, the baggage that you have, so that you could live. The whole interest is loving yourself so that you could live more. So the vaccine is given before sexual debut, and there are 3 doses of the vaccine. The first course, 4 weeks after, 6 months after, you're done with the vaccine. However, if someone has had some degree of sexual exposure, the vaccine has not been shown to do some protection. The vaccine does not give you any protection after exposure. However, it does not mean that such person is going to come down with the cancer. It takes the HPV between 10 and 15 years, after infection to develop into a full-blown cancer. And if that, it takes someone who's been exposed to have a re-exposure, have another re-exposure, continuous exposure to have that change happen, because the cell lines, there are native cell lines to different organs in the body. Cancer happens when the native cell lines have been replaced with the foreign cell lines, and they now begin to multiply, right? So, yes, the HPV vaccine is important. What I need the women folk who are listening to us this morning is, first, go do your pap smear, go do your HPV DNA cytology, go do your screening test. When you do your screening test and your screening test comes out safe, then you know that, okay, at this point now I need to watch it. I need to modify my lifestyle to make sure that my lifestyle does not put me at risk. Then even when the result is not as favorable because there are pre-invasive stages of this disease, it shows the first stage, second stage, third pre-invasive stage before you have the invasive disease. There are steps that can still be taken to salvage the situation. So, okay, that's my take. So I just yield the mic.
Yes. I know that you're saying that you're also working side by side with the show, and I really need you to just stay for maybe an extra 5-10 minutes, because I want us to get into the treatment. But before that, Fortune is here, and he's going to be speaking from the perspective of his sister, who is a cancer survivor. I know that, based on the stories that we've heard and the things that we've seen, it's one of the most difficult places to be, journeying through the treatment of cancer and the different scary moments that might come alongside it. Right. So I want you to tell us, what that journey was like for your sister from diagnosis. Was there any, ailment that came that led to her going to the hospital, or were there symptoms that she was seeing? How did she get diagnosed with cancer, and what cancers were, if you're willing to share?
Hey, Doc. Thank you for orchestrating my being here. It's good to see you, sir.
Good to see you. Good morning.
So I kept getting this call last year about my sister being sick periodically. And like the doc said, it was unusual. And I thought, well, it's the normal thing. Okay, we send money. You guys go treat her. My siblings, no parents anymore. And then it was consistent. And then October last year, they said she has to go for a surgery. Wow. I'm like, what surgery? Nobody could talk to me in clear terms. Well, we still sent money. And then after the surgery, I got to know that she's been bleeding since February last year. And after whatever surgery they did, the bleeding kept coming. So I insisted, you know what, I'm not sending a dime anymore. Let her come over to Lagos. I want to go for proper diagnosis so that whatever the situation is arrested once and for all. I never knew what I was getting into.
Wow.
Because prior to now, I've never had any experience of someone close to me having cancer or whatever. And then they brought my sister, and she was a complete shadow of the sister I used to know. Tiny, skinny, couldn't recognize me. And of course, I made some calls, one amazing Edna in church. They gave me all the necessary counsel. Some were like, take her back home. You can't do this. She can't stay with you. It's too late. Well, we made all the inquiries, and then Luth to the rescue. First, I sent her to a hospital in Ilorin for about 11 days. We said, let the diagnosis be done based on advice. And once they brought her back, difficult period, the time of the Nigerian financial issue, they brought her back the next morning, straight to Luth. I had never been to Luth prior to this time. And 4 a.m. we were out, got to Luth, made all the necessary inquiries, and then thanks to Dr. Aje and the nurses over there, they came to our rescue. Of course, for that day, I told my sister, we're not going home until you start your chemo. So we had to lodge somewhere. And then the next day, Friday, back to the hospital. Graciously, the chemo started, and it's been a journey. I can't sleep at home because she can't sleep. And then she's a lady. There's limitation to what I can do for her for privacy reason. Had to get in an exclusive caregiver, high rate payment, not even the payment, she won't sleep. And then we're praying, we're waiting for the next day to be in the hospital. Tough. Let me stop for now in case you have another question.
Wow.
But it's been
yeah, I want to know what stage it was as well.
Yeah, it was really late. Stage 4 cervical cancer. That was the That was the revelation of the series of tests that was carried out. And of course, we submitted everything to Luth. And I remember at that time, one of the nurses said, if you had not come now, probably your sister has got just a week to leave. Because as the treatment progresses, there was a time one of the nurses told me, she said, I know you don't know me, but I just want to thank you and your sister for being a fighter, because we remember when you came, your sister was as good as gone, but you guys have been coming, whatever you've been doing, whether prayers, we are happy treating your sister. And I think one of those days, Dr. Aje, we were to see him after the process of the chemo was done. I remember vividly, if Doc can still remember, because prior to then, Doc has only seen her just twice because the nurses were very, very, very good and available for us. So it wasn't every time we were there, we needed to see Dr. Aje himself. The nurses were up to the task, big time, and massive kudos to them. Doc, you can help me send our love to them. So we had to see Doc. And prior to this time, my sister had improved. I was even taking some pictures and videos because I was positive. I was like, she's going to beat this as long as she's with me. So I want to keep memories. So when we're fighting, I have videos, I have pictures. I was practically a Uber person driving. She's lying at the back. I tried to film. So I had series of a progression. And then when Doc called us in, we sat down and Doc said, okay, so where's the patient? And we're like, okay, sir, this is the patient. This is your patient. And Doc was like, what? Are you serious? He graciously apologized to her for not recognizing her. And that was when he asked if such an opportunity to be here comes up, if I would mind to come share. I said, of course, I wouldn't mind.
And I would like Doc to step in at this point, with your experience being an oncologist and you get patients who come in at stage 4. I want you to take us through the process. When you're speaking with these patients, are you telling them, it's too late? Are you, what options, what are the options, and how do you break that message down to them, letting them know that these are the possibilities, especially if it's stage 4 cancer?
So I think that's the hardest part of my job, having to look someone in the eye and tell the person the truth, right? But I have to do that so that you understand our treatment process, you understand why we're taking the measures we're taking, then you can follow us through your treatment journey. At the stage 4, there is medically, that's the spectrum, where it ends. There's distant organ spread, there's multiple organ involvement, and it's just as bad as it is. But there is the person who is involved. Has she lost faith? Has she lost hope? Is she involved in the fight? That's the first factor. The second factor are those of the caregivers. Now, I must say to you that cancer fight is a fight of the mind. It's a fight that you need to get involved in, spirit, soul, body. Yeah, it takes finances, it takes commitment, it's a struggle. So there is a burden that the caregivers, go through. There was a research that was done, psychological distress and caregiver burden, and we found out that the caregivers are as burdened as the patient themselves. So we needed to begin to look at how do we take care of these caregivers, because the time with the doctors is just about 5-10 minutes. I have a load of number of patients to see, so I cannot stay with the patient for an hour to allow the patient to tell me everything is going on. So the care outside the hospital goes to that of the caregiver. So the caregiver also has to be very determined and has to be very, 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 very mentally prepared. You notice my a lot of varies.
Yeah,
mentally
a lot of varies.
be able to take on the care of the patient. Now, I also must say that cancer care in Nigeria is expensive. Is expensive. So if there's any government official who's listening, and this is the place where to step in to make sure that the National Health Insurance Program also covers cancer. They do cover some degree of treatment, but we want a holistic care, right? That will cover the cancer patients in terms of drug buying, in terms of medications, and in terms of all other processes that are involved. Now, I must say that the NSIA, the NSIA Luth Cancer Center is the foremost cancer center we have in Nigeria, and indeed the West Africa sub-region. Yeah, we have three machines, 2 LINAC and 1 Axion machine that caters for the teeming number of patients that we see here. We also have a group of doctors and well-trained nurses that are involved in the care. So it's a whole team working together. When he came, I mean, you heard his story. There was the role that the nurses played. There was a role that the doctors played. There was a role he played. Yeah. And there was a role of a patient. Now, I decided, or the team decided, we're going to push this story out because we usually don't hear these success stories in cancer care.
Wow.
A lot of people don't know that we have this beautiful story in cancer care. Now, I can remember when he walked in, the first time I saw that woman, and the next, about the 4th or the 5th visit that she was going to make, I did not recognize her because she had completely transformed. Thank you, brother, for the care that you gave to your sister. And I know it was very heavy on you, but we're telling that story today because
I'm still recovering.
Because God is faithful, and you were there to take the baton headlong and to run with it. I couldn't recognize her. I had to apologize. And madam, I'm so sorry. I mean, you've done beautifully well. You've done beautifully well. She had metastasis to the lungs. The whole lungs was taken over. She could barely breathe. But by the time she finished her medication, she walked into my consulting office. It was beautiful. It was beautiful.
That is an absolute.
Prior to then, she was in wheelchair.
Wow.
Prior to then, she was on wheelchair. She couldn't move. I mean, she was breathless. And when I was going to see her at the 5th visit, I mean, she was beautiful. And I want to thank the establishment, want to thank the brother, want to thank God, want to thank everybody. So that's why we said, let's put this message there. Even at the stage 4, there is still hope. So it's not that people say that this cancer is stage 4.
And that's it.
The end of your days and that's it.
Wow.
No, you need to still be able to put some effort to it.
Absolutely.
Patient survives.
Absolutely. And I love the fact that you also even mentioned thank God, because I really want to know the role that your faith also played in all of this, you know, with you as a medical practitioner, doctor, and also with you, Fortune, because I've heard so many stories, I've heard testimonies as well. You know, it's a very tough terrain to be at, especially seeing your loved one go through something like this. So I want to know the role that your faith in God played in this entire journey. I think it's something that is very important to highlight as well.
You know, like I said, I never knew what I was getting into when I asked for my sister to be brought to my place. If I knew, probably I would have said, you know what, let me send money so you guys deal with this. And when I saw her, coupled with some well-meaning friends who advised that I take her back, I prayed. It was a casual prayer. But about 10 minutes later, one thing I heard was, this is not a death sentence. Amen. This is a curve in life's process.
Wow.
Those were the specific words. And boom, those words like energy into my spirit. I said, you know what? You're not leaving. You're not dying here. I'm going to do my best, even if it's for you to live another 1 week. The bottom line is this: you are not dying here. So this is going to be war. You have to be mentally prepared. And there were times I had to fight with her, insisting that she adheres to whatever the medical experts have said we should in terms of food, taking her medication, because she complains that these things are too powerful, that it just days. And I'm like, you have to. So I remember then every 12 a.m., I'm praying.
Wow.
I'm praying. At the point, they said I wasn't sleeping. I had issues with my eyes. These are new lenses. I would pray and declaring that, coupled with the medications, death far from here. So medicine is very important. Like I already shared, Luth, thank you, Luth. I know we're not done with the process, but I'm grateful for every single other day my sister is privileged to see. every medication was backed up with prayers. For those who believe in the communion, it was our daily bread, and we kept praying. And trust me, I have pictures here. I've seen my sister calibrated from death to life.
Literally.
So spirituality, it's part of the process. And thanks to Doc for also mentioning God. So if there are listeners here, if you believe in God, God is real.
Absolutely.
Of course, do your treatment, go to the hospital.
Absolutely.
Don't give up that God is real.
Amen. Wow, that is absolutely amazing. It's very inspirational, and I love the fact that we've told this story. Doc, like you mentioned, it's very important that these stories are told for those who are listening as well, to understand that you might have gotten to this point where unfortunately it was late detection, but it doesn't mean that that is a death sentence. It doesn't mean that that is the end of the road. You know, there is still light at the end of the tunnel, you know, with adhering to medical advice, the treatments, as well as, you know, your hope and your faith in God as well. All these things definitely do work. Thank you so much for taking out time to have this conversation with us. And thank you so much, Doctor. I will definitely be reaching out to you ever so often, because we need to have more conversations such as this. We need to ensure that we are sensitizing people, especially as regards the role that we play in our lifestyle choices to better our health. It is very important. These are the conversations that need to be had. Thank you so much, Doctor. I do appreciate it.
Privilege is mine. I'm grateful to be on this platform and grateful to share our story.
All right, thank you, and thank you, Fortune.
Thank you so much for having me.
Thank you so much. And our love to your sister as well.
I will. She'll get your message. Thank you.